it was clear when he said, the people of Guam just need to be patient. And then he was like, but I know they've been patient. Hey, let's keep it going here. We're KUAM FM and Agani Guam. Want to bring on Holly from the Guam Women's Chamber to catch up on some of the... Good morning, Holly.
Hi, Holly.
Good morning, Chris. Good morning, Sabrina. How are you guys doing?
We're doing pretty good. Just wanted to talk about some of the reopenings, and I'm wondering if you could maybe shed a little light on some of the guidance that's going to be in play when we do these reopenings tomorrow morning.
Absolutely. Yeah, so we have a lot of reopenings coming out. We do have an official guidance coming out later today, which we will be publishing on our website, and that's guamwomenschamber.com. So we definitely will have that available.
Is this the guidance for Guam Women's, or is this the guidance as a member of the Economic Recovery Group?
This is just guidance for the public,
okay.
And for businesses to open.
Okay.
So what will be, So what will be actually published to give more firm guidelines on and requirements, especially for the dine-in restaurants, will be released today. So I know there was some guidelines released. There's a little bit more on the requirements that'll be available, so that'll be really wonderful for people, because I know restaurants are excited to be opening. People are excited to be going out. There's graduations happening. You know what I mean? Like, people want to enjoy. So it's going to be really exciting. So we're really excited about all the reopenings that are going on in this gradual kind of release of restrictions.
This is you guys going to do a FAQ like you did last time?
Yeah, we absolutely could. We try to keep that conversation going. If we don't release a PowerPoint FAQ, then we've been doing virtual town hall FAQs as well, and getting the key players on board so they can answer those questions, and just really being able to be someone who's communicating the message, right? Both chambers are doing that right now, and I think it's exciting to be a part of that, to see, okay, what kind of questions are coming in from the business owners? How can we relay that communication and just, get the information or resources out there to help people open up and, just to streamline that entire process.
What can you tell us about the, maybe more clarity on what types of fitness services are going to be allowed to open? Because I think I get what the governor was trying to say, but what kind of threw it off for a lot of people was, she said, dancing, yoga, Pilates, but not gyms. So,
right. I think that's a little bit okay. So that's So to clarify that, from what I know, is you can have fitness classes, but it's not just the open areas or the open spaces. So if they have a fitness class, they may go to that, because that's a lot easier to maintain, spacing, cleaning before and after classes, that sort of thing. But as far as just having open gyms where people can go in and work out at their own leisure, she doesn't want that open at this point in time, because that's a little bit harder to control.
So if a gym offers yoga, if a gym offers CrossFit, they can open, but they just people can't go in and for the class.
For those specific classes.
But if they have like a treadmill class, then you could go on the treadmill. So basically,
I imagine if they had, you could do
like
that,
a bike class, cycling.
Yeah, exactly, because you can clean the equipment before and after. You can maintain the number of people in there for the duration of the time, etc. Right, so it's easier to control.
So I guess the way to get around it would be to have a open gym individual workout class.
I guess, I guess that's one way of looking at it. So.
No, I mean, the businesses obviously are getting creative with how they're going to reopen, and so and talking with all
classes, I've seen really creative things out there, like, okay, this is 6 feet apart, we're spacing you guys out, we're doing it outside where there's more airflow, and they're having people sign in just in case for contact tracing. I mean, they are being really creative, and I think that's just a part of something we're seeing coming out of this, is how creative and innovative business owners are and people are in general.
What about,
so if I have a personal trainer and I want to go to Paradise, right, to work out with my personal trainer, that would be allowed?
I believe so. I believe that was mentioned, personal training as well, because it's the same thing. You can control it, you can schedule it, you can have a certain amount of people, so on those kind of things, just as long as it's not just open, anyone coming in at their leisure, that sort of thing.
Real quick, guys, we're KUAM FM, Agani Guam. Good morning to our viewers on KUAM TV 11. It's the KUAM News Takeover containing COVID here on I-94, and on the line we have Holly Rustick from the Guam Women's Chamber, and she's also a member of the Governor's Recovery Panel of Advisors. What about jiu-jitsu, Holly? That's a class atmosphere, and we're getting a lot of comments about that.
I don't know specifically for that one. I do know that close contact sports or close contact classes were not being as far as promoted, even in the regular guidelines for gyms. That was something even business members had put forth in their guidelines, that they would restrict those classes at this point in time. So unfortunately, that's just, it's too close contact. So under my understanding, those things are not, very close contact classes or sports are not enabled yet or allowed, or the gradual rollout will happen at some point, but
right.
I don't believe that at this point in time. Yeah.
But people are working on those guidelines. Because I know, for example, I have my son, he trains here in Guam, but he also trains when we go on vacation in Vegas. And so the gym in Vegas is actually getting ready to reopen. The jiu-jitsu gym.
People definitely, people can get ready, they can get guidelines prepared, and that's what we're encouraging all businesses to do. If you're not open yet and you don't feel like you're on the list, let's say, still put your guidelines forward, and that's, the chambers, we're both accepting those if you want to send those to us or to public health. I mean, get your name out there, get your guidelines prepared. If you need help preparing those, contact us. Don't feel like just because your name isn't there that you might not be considered. Definitely, advocate for yourself, and that's what we're here to help advocate for you as well, for business owners. We can't guarantee, of course, that, you're going to be open, the next time it comes up next week or whenever, the next release is, but at least you're on the table and there's consideration going on, and there might be discussion on that to figure out, okay, well, maybe these guidelines could be tweaked in this way to make it, a little bit more just acceptable, that sort of thing.
Right. Yeah. What about in the 24 hours since the last 24 hours? Have there been any developments at all with the daycares and the child care centers?
Right. So we're working really hard. Guam Women's Chamber of Commerce, of course, we look at this as a four-pronged item, and it's very important to us. We're passionate about it because women are definitely, disproportional in as far as owning daycares and needing daycares and working at daycares, right? So as far as we have a lot of business owners that are women, and they are putting forward their guidelines. They are being very, assertive, and they're out there. They're very proactive, which is great. We've been working with the Guam, the Guam Child Care Association, and it's just been really great. But we also see, of course, a lot of our members are parents and they need daycare. And then we have, members that could be employees at daycare. And then, of course, other business owners, like you heard, of course, Jaylene Kent. I heard Dr. Kent on the radio yesterday, and she had mentioned, of course, she owns a business and one of her employees needs childcare, right? So there's like this four-pronged, kind of approach to looking at childcare. It's really an integral part of our economy. So it's really important, and we're passionate about it. We have been continuing to communicate with public health. Right now, we have forwarded everything that we have in guidelines, and we are in discussion with public health as far as what that looks like. And, what we're hearing from public health at this point in time is they need more time. They're a little bit cautious, especially because of the cluster of the 11 last week that were positive. And, the thing is kids, CDC guidelines even say under 2 and under don't wear masks. That's not good for your development, and you can't really social distance kids, so they are more vulnerable age group. So there is that to consider. Absolutely, of course, we're sensitive about our children too. So it is a very complicated kind of issue, and we are looking at other case studies of states that are opening, even countries, that are opening daycares. And I think it's something that they are definitely considering, but right now they just really need to make sure that, the numbers are where they need to be and everything like that. So I don't think it's a case of if they're going to open, it's when, right? So we're advocating for that. We're definitely trying to have better communication as far as between public health and the businesses. I was really happy to hear yesterday when they said, when public health said, you can go into your businesses now and start preparing. So that's what businesses were waiting for. They're like, okay, we understand we might not be able to open up tomorrow, but we need to get ready. So it's a part of having that communication. And I think we're definitely going to continue to advocate for that. So at least there's that continued conversation so the businesses can be prepared, and the parents, right?
But it sounded like when we talked with public health yesterday that they're, I want to say, not even at the beginning of the process to look at what it takes. They were saying, we're still coming up with, there's no federal guidelines really, so we're kind of on the drawing board still.
Well, there are CDC guidelines, and we have talked to them since yesterday. So that was a good thing, too, that we were able to continue that conversation. And from what we're hearing from public health is, okay, we've got your guidelines and we got the Child Care Association guidelines. We have all the guidelines now. We're seeing that there's other CDC out there guidelines and recommendations. We're reviewing those. However, we are still, this population is still a high-risk population. So we need to really look at this in more detail. We need more time. So that's what we're hearing currently. It's not that it's completely off the burner or anything like that, but it's just like, okay, we still need more time to look at this and to see how this is going to affect our population, especially as we're seeing these little cluster groups, and they're saying that could be a really high-risk area because they're clusters of kids not wearing masks and not social distancing. So that's just, what one of their concerns.
So what are the I guess the documents that you've seen, the guidelines, the proposals that some of these daycare facilities that have submitted? Are we looking at like you can open for toddlers but just not the infant room, or you know what I mean?
No, it's not that. Yeah, I know what you're saying. It's more about opening in smaller groups. Actually, the clusters can be a bad thing and they can be a good thing, right? So they're looking at clusters actually being a good thing from the child care perspective. As far as we can contain, I think what I've seen is up to 12 kids, and I think that would depend on the age group, but those kids would always be in the same room and they would always be together and they wouldn't intermingle with the other groups in other rooms. So they wouldn't have like co-playground or co-eating, that sort of thing. They would have, it's staggered, so the kids are eating in the room, that sort of thing. So they actually keep these little clusters together, and then that way it's easier, to contact trace as well, right? So you're having, so, and there are, like, of course, like I said, 2 and under, not wearing masks, and you can't really social distance younger kids, and they're not saying that they would do that. They're saying more hygiene, cleaning, and daycare is, they've always had strict standards anyways. This goes back to the conversation even about like hair salons and, that sort of thing opening up. It's like, well, they've already had very strict controls as far as their cleaning processes. So, but of course it would be more increased in the kids washing their hands every hour and, the staff wearing masks, that sort of thing. So it's kind of a gradual. Some daycares too would have limited amount of kids. And of course that would be, how many rooms do they have and how many kids can they have per room, right? So it would, sorry, go ahead.
No, I wanted to follow up on the CARES Act funding that I guess the congressman has been mentioning, and even I guess it's $6.4 million. It's been available since April, and a portion of that funding actually would go to these daycare providers to sanitize and disinfect, prepare their facilities. Do you know anything on the distribution of those funds?
It's something that we're really looking into still. We're asking, and as soon as I get that information, of course, we can share with you guys. I mean, because that's really, we're wanting to know exactly how that'll be laid out too. And I believe it's all with public health right now. So that's something we're following up with public health on. And so I mean, that'll be good for just, of course, the daycares to know what that is. I've kind of heard it in reference to block grant, but I'm not sure how that rolls out because there's already block grant. So that's something definitely that we're interested in finding out as well.
Right. I know public health said that they had been making payments as part of this block grant based on enrollment. But I guess there wasn't just that clarity on, but what about the funding for these daycares in general for the disinfecting, the PPEs and all of that? So.
Exactly. So that's my understanding as well, as there's block grant funds already earmarked. So what is this part of that paying that out, or how is that? So it's definitely something we're asking about as well. And I'm sure we'll get that information soon. So it's just, once again, public health is really busy, but they're doing their best to communicate with us. They've got a lot going on. I know they have the whole discussion on SNAP today. They have a lot of different programs they're rolling out, and they really have been proactive with communicating with us as best as they can, right? So it is just that following up and us having those discussions.
Holly, going back to the dine-in, so you said the guidance is coming out today. Is that what you said?
Yeah.
Okay.
Yeah.
Well, public health issued their guidance yesterday, but this is a separate one from...
I believe there's more detailed requirements.
Yeah, because I think people want to go out to eat, but we don't know what the hell is going to happen, and I don't want to go in blind because I want to know what the guidelines are so I can ensure that the business is adhering to them, right?
Yeah, exactly. So what I heard is that we will have more of those detailed requirements today that we can definitely share on our website, like I said, and we'll be sending out to our members as well. But in general, it's the 50%, right? And we'll get more of the detailed requirements. So that's exciting. You know, if you're looking forward to going out and enjoying a dinner outside your home.
Right. Okay, Holly. Well, thank you for your time, and we got your number. Great resource. So we're gonna use that number frequently.
Yeah,
okay.
I appreciate you guys also spreading the word and getting the message out there and helping with the communication. I think it's really, you know, it's important, right? So that we're just going through this process together and figuring it out. It's kind of a dance as we go along, but I think you know, we're being
heads up, I'm not the best dancer, just so everybody knows. Watch your toes. Watch your toes.
That's right. Get your dance class going.
Yeah, I got to go to dance class. That's what it is. Thank you, Holly.
Thanks, Holly.
Thanks so much.
Wash your hands.
Yep.
Okay. 8:14. We're gonna take a break. Come back, do our anthems, do our news, and then we're also gonna hear from Dr. Vince Duenas from the FHP Take Care Family Clinics to find out how their response to the COVID-19 pandemic has gone, and also find out a little bit more about the payment of these Tier 2 clinics. That's coming up here on the KUAM News Takeover, Guam's favorite, containing COVID. Good morning.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of